Hi everyone, thank you for tuning in to my channel. If this is your first time here, hello, welcome. If you are a returning watcher, I just want to thank you for your continued support. So today's video will focus on mental health NCLEX questions. So you will have the question, and then you will have a voiceover with the rationales. Hope you enjoy it. Hope you learn a lot about mental health. The nurse is planning care for a client admitted with suicidal ideations. To best assume client safety, the nurse will implement additional precautions during which time period? Is it 1, during the day shift, 2, on a weekday evening, 3, between 8 a.m. to 10 a.m., or 4, during the unit shift change? Give you some time to think about it. So, if you chose 4, you are correct. So, at shift change, there is often less availability of the staff. The psychiatric nurse and staff should increase precautions for suicidal clients at this time. The question reads, the nurse in the mental health unit is preparing to admit a severely depressed client. Which findings on assessment support the diagnosis of this client? Select all that apply. Is it 1, asomnia, 2, a flat affect, 3, hypersomnia, 4, substantial weight loss, 5, weight gain since onset of depression, or 6, reports, I don't have any more tears to cry. So this is to select all that apply. So if you chose 1, 2, 4, and 6, you are correct. Let me repeat again. 1, 2, 4, and 6, you are correct. So in severely depressed client, loss of weight is typical, whereas mildly depressed clients may experience a weight gain. Sleep is generally affected in a similar way with hypersomnia in mildly depressed clients and asomnia in severely depressed client. So the severely depressed client may report that they have no tears left for crying. A flat affect may be associated with depression. So the answer is 1, 2, 4, and 6. The nurse is planning care for a suicidal client who is hallucinating and delusional. Which intervention should the nurse incorporate into the nursing care plan to best ensure the client's safety? Is it 1, check the client's location every 15 minutes, 2, begin suicidal precaution with 30-minute checks, 3, initiate one-to-one suicidal precaution immediately, or 4, ask the client to report suicidal thoughts immediately? Give you some time. So if you chose 3, you are correct. So one-to-one suicide precautions are required for a client rescued from a suicide attempt. So in this situation, additional significant information is that the client is delusional and hallucinating. Both of these factors increase the risk of an unpredictable behavior, compromised judgment, and the risk for suicide. A client who has expressed suicide ideations upon admission is being discharged home with the family. Which statement by the family member might constitute criteria for delaying discharge? Is it 1, the client's wife asks, does he know that I've already moved out and filed for divorce? 2, the client daughter states, I've decided to postpone my wedding until my dad is feeling better. 3, the client's son states one of his friends visited last week to tell us the dad's union is out on strike. Or 4, the client's brother asks, will my brother be able to continue as the executive of our parents' trust? So if you chose 1, you are correct. So single and divorced and widow clients have suicide rates that are greater than those that are married. The nurse is developing a plan of care for an older client diagnosed with dementia. The nurse develops which realistic outcome for the client? Is it 1, the client will function at the highest level of independence possible. 2, the client will be admitted to a nursing home to have the needs of activities of daily living met. 3, the client will complete all activities of daily living independently within 1 hour to an hour and a half time frame. Or 4, the nursing staff will attend to all the client's activities of daily living during the hospital stay. So If you chose 1, you are correct. So all clients, regardless of age, need to be encouraged to perform at the highest level of independence possible. This contributes to the client's sense of control and well-being. A client with a diagnosis of schizophrenia is experiencing visual hallucination. The nurse plans care based on the determination that the symptoms is related to an alteration in brain function in which lobe of the cerebrum. All right, so you're going to look at the figure below, and then you're going to pick the correct lobe. So, if you chose D, you are correct. So, visual hallucination indicate an alteration in the brain function in the cerebrum. The occipital lobe is located in the back of the head and is primarily responsible for seeing and receiving information and is responsible for visual hallucinations. The nurse is assessing a patient's suicide potential. Which question is most important for the nurse to ask the client? 1, why do you want to harm yourself? 2, do you have a plan to hurt yourself? 3, has anyone in your family committed suicide? Or 4, can you describe how you're feeling right now? So, if you chose 2, you are correct. Do you have a plan to hurt yourself? So, when assessing for suicide risk, the nurse must evaluate whether the client has a plan or not. So, clients who have a plan pose a greater risk for suicide. The nurse is caring for a client who is receiving electroconvulsive therapy, ECT, for a diagnosis of major depressive disorder. Which assessment findings should the nurse identify as an expected short-term side effect of ECT that do not require notifying the healthcare provider? Select all that apply. Is it 1, confusion, 2, memory loss, 3, hypertension, 4, disorientation, 5, heart palpitations? Give you some time to think about it because this is a select all that apply question. So, if you chose 1, 2, and 4, 1, 2, and 4, you are correct. So, the major expected side effects of ECT are confusion, disorientation, and memory loss. A change in blood pressure or the presence of heart palpitations would not be anticipated and should be reported to the doctor because this is something to be concerned about. The nurse is caring for a client who has been diagnosed with bipolar disorder and is in the manic phase. The nurse determines that which group of foods would be best for this client. Is it 1, a beef stew, fruit salad, and tea? 2, cheeseburger, banana, milk. 3, macaroni and cheese, apple, and milk. 4, scrambled eggs, orange juice, and coffee. All right, so the answer is going to be 2. So the client in a manic state often has inadequate food intake as the result of physical agitation. So foods that the client can eat on the run are best because the client is too active to sit down and eat a meal and use utensils. Additionally, the clients in the manic phase should not have any products that contain caffeine. The nurse is preparing to implement suicide precautions for an acutely suicidal client. Which nursing interventions are included with regard to these precautions? Select all that apply. Is it 1, maintain arm's length distance with the client at all times? 2, ensure that meal trays contain no glass or metal silverware. 3, carefully watch the client swallow each dose of medication. 4, conduct one-on-one nursing observation and interaction 24 hours a day. 5, document the client's mood and verbal statements and behavior every 15 to 30 minutes per protocol. Or 6, allow the client to totally cover themselves with bed covers during sleep at night as long as the nurse is present. Give you some time to think about it because this is a select all that apply. So if you chose 1, 2, 3, 4, and 5, you are correct. 1, 2, 3, 4, and 5, you are correct.